Hello everyone. This video will cover flu, COVID, and strep testing. In terms of when to run these tests, specifically for COVID and for flu testing, these can be done while you're triaging a patient. When do we test the patient? Basically, you would need to refer to the little cheat sheet that is in the triage room that will tell you when to run each test, depending on specific symptoms and most importantly, the duration of those symptoms. Please make sure that when you do run a flu or COVID test, that you also run it with a PCR. This will help us avoid having to go into the room again, swabbing the patient for a second time and inconveniencing them. So you would go ahead and run the test along with a PCR, and if the rapid test is negative, then we already have the PCR test available to send out to the lab if necessary. For strep testing, please don't run the strep test unless the provider orders it. The only exception is if there's an insistent parent or they mention it, hey, can I get strep testing? Especially if it's a child, they have a sore throat, run it quickly by the provider, and most likely the provider will say, sure, go ahead and run it. Now, generally providers like to use what's known as a Centaur score if they have specific symptoms or non-symptoms on a point scale called the Centaur score. They would go ahead and treat them anyway, irrespective of the strep results. Positive, obviously they treat them. Even negative, if they meet the criteria, they would still treat them either way. Again, ask the patient, tell them that, hey, based on your symptoms, we'd like to go ahead and run the test. And for the most part, there's no issues there. Most patients are compliant and they're fine with it. Please, when you do set up the test, in terms of protection, obviously always wear gloves. Please put on a mask. For patients that are coughing when they first come in, now receptionists are told to offer a mask to patients that are coughing. If you see a patient in the room with you coughing and is not masked, please again offer them a mask. And when you do test them, you want them to pull down the mask under their nose, keep their mouth covered, and go ahead and administer the test in the nasal cavity. And then finally, before I end this video and then set up another video to show you how the test is actually administered on a patient, make sure you have a pen in there and you are putting the basically the patient demographic or patient identifiers on the tests, be it the rapid test where you would put like at the initials, make sure you put the time. You have to put the time on there, and preferably also a room number. On the PCR vial, you have to put a name and a birthday. The rapid, again, they can be tossed in the garbage when they're done with them. They won't be able to, identify a patient. It's not a HIPAA violation. Now the vial, the PCR vial, that one, if the provider decides they don't want to use it, they would throw it in the sharps container to avoid having it go into the garbage where it may be, the patient information may be compromised. Again, please ask questions, know what you're doing. If you're not sure, again, the golden rule is be ready to administer the test. Don't look like you're clueless in there, especially if you're new, obviously. Make sure you follow things step by step, prep all the tests, make sure things are properly labeled. And obviously when you bring out the test from the room, go ahead and give it to the provider. What I would recommend is before you move them to another room is to double check on the test and make sure it's not positive. If it's positive, preferably you'd want to keep them in the triage room. And a lot of times providers, what they would do is they would prioritize those patients, go in there, they mask up, they go in there, they see them and get them out of the clinic as quick as possible to avoid contaminating a second room. And with that being said, we'll go ahead and end this video, and then on the next video you'll be able to watch how a flu test, a COVID test, which are very similar, pretty much almost identical, as well as a strep test is administered. Thank you.